Welcome back. So there will be a lot of expectations concerning what happens today. How do we integrate ourselves into, this next phase, whatever the phase is or whatever the phase will be. Well, to give us some perspective on what has happened previously, an idea of where we are, and perhaps what we should look forward to, we've got Professor Innocent Uja joining us from Abuja. Well, good morning, sir. I remember the last time you were here as the DG of NIMR, but now you are the president of the NMA. Congratulations on your election, on your victory.
Thank you very much, Chamberlain. Good morning and happy new month.
Well, it's going to be a very interesting one for you, the NMA. What a time to be the president of NMA. What do you plan, how do you plan to approach your leadership? Because, the country will be looking to see there are several things playing out in different states of which you need to coordinate, even at the center as well. So what should we expect from your tenure as the president of NMA?
Well, thank you very much, Chamberlain. Like I said, happy new month. Before I start, I want to thank my colleagues for giving me the victory, for voting for me, for having confidence in me, and I also dedicate my victory to my family, my wife and my children, and my very good friend, Dr. Dennis Ifene of the blessed memory, with whom we have come all this way. The question you asked is very relevant. There's no doubt that there are very many challenges, in the health system in Nigeria and the welfare of Nigerian doctors. The challenges are enormous, but we are prepared to hit the ground running. One, the issue of the COVID pandemic and the response. And as it affects my members and other health workers, and in fact the Nigerian community and the socio-economic circumstances of the time. The second is the issue of the welfare of Nigerian doctors. The third is working with partnership with government and other agencies to improve the health care of Nigerians. There's no doubt that the COVID pandemic, the global health emergency caused by COVID-19 has exposed how weak the health system of Nigeria is. It's very clear that there are lots of gaps, and that has made it really, really difficult to respond appropriately. People are doing their best, but there's a lot of work to do. We work with other agencies. We will improve on our capacity development because doctors must continually be trained, and we'll enhance that. We will bring to bear, what we call a public lecture, annual public lecture for Nigerians on contemporary issues, because we cannot stay in a Nigerian community and not respond appropriately to the happenings in Nigeria. So this is a summary of what we'll be doing, but by and large, the greatest challenge now is how effective and how appropriate we will respond to the COVID pandemic. It's a global health emergency, not just health, but social and economic. You can see that we've been locked down for about 6 weeks, and a lot of things are happening. So we will need to interface with government and support and contribute to the containment of the COVID-19 pandemic, because Nigerians are suffering.
Now, if I could just bring in this, you have highlighted some of the challenges that the health sector is facing, as many other people, even those in government, have also pointed out. Have you heard anything that gladdens your heart about what the country ought to do next, or what they are planning to do next, having seen the gaps that the health sector is facing?
Well, the issue is that they are doing their best. The government is doing its best. The health workers are doing their best. And the partners are doing their best, but you can see that we need to review. We need to review what we are doing. Is it appropriate? Is it correct? And this comes through what? Evaluation of our activities. As a researcher, I think that we should have a very strong research team that will evaluate our activities, because it's not enough. You know, if we are doing this, if it's working well, how will it work better? If it's not working well, how will it do it? What would we do? And research findings is not, anything that is very fantastic. It's just data assessment and evaluation. And I'm not very sure, and I cannot say because I do not know, that the PTF has a research team to evaluate their activities, because we must evaluate, we must monitor what we do, so that we can then reorganize ourselves to see how we can appropriately respond to the pandemic, which is actually causing a lot of problem, not just to Nigeria, but to the world. But we need to do our own bit. We then necessarily need a research team. I understand that there is an advisory team headed by a great virologist, Professor Tumori. I don't know their terms of reference, but the reality is that we need to have a research team that will monitor regularly and evaluate what we are doing, because otherwise we'll just be groping in the dark.
Are you saying by that, just one moment, Professor, you've just talked about the need for research. Now, a quick follow-up on that before my question. Are you saying that the research apparatus that we have in Nigeria are not enough? Of course, you have been DG of a medical research institute in Nigeria, and that, of course, you are not unaware of NIPRID and a few other agencies of government that have been involved in research and which have, produced one thing or the other. Are you saying those research facilities are not enough, or what exactly are you talking about?
No. What I'm saying is that the response must be evaluated, and you don't need to have a NIPRID or NIMA, even though they should contribute. But there must be a research team of the PTF that will evaluate the activities regularly. If you say we should wear face mask, what's the percentage of Nigerians that are wearing face mask in Abuja? You say social distancing, that is completely out. There's nothing like that, social distancing, in my own observation. I've gone through to places like Nyanya, Mararaba, and it is just business as usual. Go to the market. There's nothing like social distancing, and we need to know why it is so. We talked about self-isolation, and I think that is one area that we probably didn't get it right. The self-isolation, how can a family of 10 in Face Me and Face You house have self-isolation? Self-isolation if it comes back. Our culture and tradition must be evaluated to see how we can appropriately respond. For instance, if not because of the lockdown, I return from, say, United Kingdom, and then you say I should just go and stay in one room. Is it culturally acceptable? Now my people will welcome me, my daughter or my son will come and hug me, and before you know, if I was carrying the virus, I would have transmitted the virus, to the family. And then, of course, many Nigerians live in rooms, Face Me and Face You room, and with 10, 11 children, on what ground can they self-isolate? On what ground can they have social distancing or physical distancing? It's practically impossible, and we must not deceive ourselves. What we need to do is to respond appropriately using our culture and custom and see what we can do to help us. When Ebola we had Ebola, the issue of social distance that did not come. We know that the mechanism of transmission is different. But people were working, but the health, the Nigerians, we were practicing hand washing, we were using hand sanitizers, we were using thermometer to measure ourselves, and it worked. It appeared to work, and I thought it worked. Now, I believe that we should intensify that. Apart from that, the National Orientation Agency should do its work. Because this thing came and it was thought that it is going to go away you know, by prayers and by wish.
Well, Professor Oja, if I could just jump in and ask you, should we expect from the NMA, for instance, having seen how all of this has played out and, you know, the challenges that we face, should we expect NMA to itemize some of these things? I mean, in case the government or someone somewhere may lose track of these things and turn to some other things that, you know, how one thing can happen and it turns the attention of the entire country to that matter, and we then forget that we still have a huge challenge with the health sector. For instance, many Nigerians, once you get to the hospitals, the first thing is, look, if you don't deposit a certain amount of money, it doesn't matter the condition of whoever you brought or yourself, you won't be attended to. Health insurance is a challenge in this country. So are you going to itemize some of these things such that everyone, or you can forward them to government eventually, saying, look, these are the areas, perhaps low-hanging fruit of what they need to address immediately, to give us at least a semblance of what people can then say, well, at least we have a health sector that's responsive.
Well, thank you very much, Chamberlain. Policies are not a problem in Nigeria. I was in the National Institute for Policy and Strategic Studies, and if you go there, you see the deposit of research work that was done. You can write, but you cannot force government to decide to implement. The truth of the matter is that my administration will work very closely with government, and I believe that they will listen to us. They should listen to us because this is our domain. We have strategic advantage over, you know, other practitioners, and they should be able to listen to us. We have made our inputs, and will continue to make our inputs to the policies of government. But it is love for them to implement. If they refuse to implement, we don't have that powers to compel them to implement. But we believe that working with government and clear understanding, collaboration, advocacy, and consultation, I believe that government will take the NMA more seriously than before. Because, for instance, the PTF has no NMA representative. I mean, we cannot be shaving our hair. They cannot be shaving our hair in our absence. The truth of the matter is that health is a custodian of medical doctors. We are the leaders of the team. And we should at least be part of the process. We should not be waiting and then be asked. We should be able to let them know at the right time that this is what we should do and how we should do them. It doesn't mean that we have monopoly of knowledge. We consult with others, with other members of the health team, and work as a team to bring out the best in the national response to the pandemic, as it were. And the issue of the hospital, like we said, if there are emergencies, no emergency will be turned out. Every emergency must be treated, and that allows for the first 24 hours after the emergency. And if the doctor evaluates and finds that the emergency is not over, we're obligated to continue to treat without asking for money. And I believe my colleagues in the teaching and the specialist hospitals do understand this. But you know, we don't have control over this.
Dr. Oja, Prof, when you say these things, it's different in terms of what's practicable out there. Because if you say the first, 24 hours, they should treat with these things don't happen in the hospitals.
That's what I'm saying. And it should be implemented, it should be evaluated. If it's not happening, why is it not happening? The government has policy. The government should monitor its policy. We have, in a federal establishment, we have a Department of Hospital Services. Its responsibility is to oversee the teaching and specialist hospitals of federal government. The state governments have their own. What we need to do is to monitor. It's not enough to say 24 hours, you should after 24 hours, or you should not pay anything for the first 24 hours. If that is the policy, why is it not working? That's the evaluation I talk about. And that is a basic research that should be done. It's normal, just data collection and analysis, and then bring out facts. Because we must talk with evidence. The time of speculation is over. The time
collaboration.
Is over.
Right. In terms of collaboration, I mean, with the PTF at the federal level, and of course, maybe the EOCs at the state levels, I'd like to know what specific terms you're talking about. Because if you say the NMA is not represented, for example, you talk about shaving your head in your absence. But I look at the PTF, for example, and I can count at least 4 medical doctors. You have the coordinator of the PTF, Dr. Aliyu, you have the Minister of Health, the Minister of State for Health, you have the DG of the NCDC, all of them medical doctors, and I want to believe members of the NMA. So in what specific ways are you looking to collaborate with the PTF?
Apart from NCDC are politicians. They are
Get that, sorry.
They are politicians. And,
okay.
and I just want to let you know, yes, they have their knowledge, but they are not practicing. They are administrators. They are administrators. We are looking at people who have evidence from the practice. The national coordinator, yes, is a medical doctor, but he could not do it alone. I'm saying that we need to be involved. We should not be at the sideline. We need to be involved. And it is not, we are saying not, it is not out of arrogance or disease, because we are the custodians. And that's what I mean. We should be involved, closely involved. It is not about saying that we have a Minister of State. They are all doctors, that is true, but they are administrators.
But in what specific, I understand.
Those that are in the field, the enemy is in the field.
So in what specific ways? Because, I mean, I'm glad you're bringing these ideas. So in what specific ways do you want to be involved?
The PTF has terms of reference. We want to be involved in every aspect of the terms of reference, apart from money. We are not dealing with money. We are not finance officers. But the reality is that I have mentioned, I'm not sure whether the PTF has a research team. Now, if you involve an NMA knows every of his members and the capacity of his members, and bring them together within a short time, do this and want results in the next 48 hours. And they will do it. But perhaps look at and say, Uja is handsome, or is this, I'll bring him. What is the impact? I mean, look at it. We have epidemiologists, we have infectious disease specialists. Where are they? Where are they? That is what I am asking.
Professor, perhaps another way to look at this would be to even, well, there was something you mentioned earlier about collaboration with various agencies and all of that, and that's a given. But perhaps, you know, you may also reference the fact that this pandemic has, you know, revealed certain serious fault lines in the healthcare delivery sector in Nigeria, the entire gamut. For instance, while the NMA is making agitations, Association of Nurses and Midwives want recognition, lab scientists want recognition, biologists want, different segments of the healthcare value chain are looking for recognition one way or another. So if there is going to be a collaboration, don't you think that's where the whole thing should start from, where every agency, every association, every segment of the healthcare value chain is represented under one umbrella? And if you say the NMA is the lead body in all of these, is this fact accepted by all in the healthcare value chain?
Let me just say that we are not in a beauty contest field. It's not about the doctor or nurses or pharmacists or no, to be recognized. We are not looking for recognition because we already have recognition. What we want to do is to work. And if you say we agree that we should all work together, but who was the coordinating body? The coordinating body is the Federal Ministry of Health. They should put us together and let's work. We want to work. We are not interested in recognition. The doctor is not being recognized. The doctor is already recognized.
One moment, profs. One moment. Would you be happy, would you be willing to make any moves to bring together all the practitioners in the healthcare value chain, the NMA, the nurses and midwives, biologists, you know, lab scientists and all? Would you, is this something that, is it an opinion that you think, you know, you might want to experiment?
Well, why not? Why not? Is there any reason for not coming together? We're all health workers. We come together. In fact, my predecessor did a lot to improve the harmony, interprofessional harmony among the healthcare professionals. We should work together. We have a common objective. common objective to see how patients are properly treated and they discharge, with minimal complications that may arise. There's nothing wrong with that. We could do that, and I can assure you that when I emerged as president of NMA, the other professional bodies sent messages of congratulations, and that is what we want in Nigeria. It's not a beauty contest. The doctor is clearly the leader of the health team, but we must work with others, even with the messengers in the hospital, because the messenger is also important. The security people are important. Anybody working in a system is important, but there must be a leader, and that's what the doctor is. It's just like, we entering the plane, and we have the pilot, and the pilot is the commander. There's no two way about that. But there are all other cabin staff that are working. So it's not an issue of the doctor says we're not the only one. Even in all systems, even in accounting, you have the accountant. In the armed forces, you have the army chief, and you have all the others working. Do you know that in the armed forces, a doctor is a support staff? As great as a doctor is, because a doctor can never be an army chief. That is the truth. Just the same like the Air Force and the Navy. So we must know our operational capacities, our callings, and there shouldn't be any problem with this. I think probably some outsiders causing some misunderstanding among the healthcare professionals. Otherwise, there shouldn't be any problem as to who is what. And I can clearly tell you that we work together. I am very, very interested in working. We are our colleagues, and we know we have defined roles and responsibilities, and that should be clearly known to all of us. And I don't see any problem with that. So in the final statement on this is that we can work together and work for the health of Nigerians. Because Nigeria, and like I said, this pandemic has exposed the weak health system in Nigeria. It is thoroughly, thoroughly obvious. And perhaps this is time to talk about the Chief Medical Officer of Health, also Surgeon General, that we have been advocating for years. You could see that coordination in the pandemic here is not as effective as it should have been. We know that there should be unity of command, and the president is doing his best. But how can a state go against the directive of the president in a national emergency? The state says they don't have COVID. Nobody should come and do their test, and that nobody, if you come, you'll be quarantined. There must be unity of command.
Okay, Prof.
Coordination.
What we'll do is we'll talk about that a little more when we return in a moment. Stay with us. All right, welcome back. Well, Professor Anthony Innocent Tuja did talk about the developments in Kogi. But, Prof, what do you expect to happen at this point in time? Because the NCDC did say, look, these are facts as they were. And then if Kogi is saying, look, they don't accept those kind of results. In fact, there was even a protest in Kogi against the cases that have been declared by the NCDC. How do you suggest this be handled moving forward?
Thank you very much. I have earlier talked about unity of command. This is a national emergency. In fact, it's a national emergency. The president is in charge. The president should compel the governor of Kogi State for health workers to have access to the people. You see, one of the greatest challenges we had was the polio issues in the north of Nigeria, which eventually I'm happy that have been sorted out. You cannot hide diseases. Even if there is none, let's have evidence that there is none. They should test. It doesn't matter. Some of the things we do is to bring out evidence. And it's not to say that you wait until they have before people can come in. I think that in this case, the commander-in-chief should use his powers and authority to compel the governor of Kogi State to allow access of health workers who are actually suffering to our people. Because when it exploded, when it explodes, like it did in Kano, it will be very difficult to contain. Let's prevent. You all say that prevention is better than cure. So why do we have to wait until we have explosion in Kogi State? Kogi State cannot be outside of Nigeria. There is a pattern, epidemiologically, there is a pattern of diseases. There is no way that Kogi State can be an isolated place. It is not correct. And I believe that if once the commander-in-chief decides and directs, and then, of course, with the coordination of the process, we should get into Kogi State and find out if there is none, if there are no cases of COVID-19 in Kogi State. Why will he not be happy for us to give him an award for being very effective?
But when now talking about that unity in code having one approach, the indication we have from the PTF, we're expecting to see what the next direction will be. But what we have so far is that states will be taking more responsibility. So it appears as though states will get maybe some more freedom to choose what works for them. So do you still think that would give us that unity, that singular approach from top to bottom in court if we're moving to a phase where states will have more responsibility?
When that of Kano started, the first thing the governor of Kano said he needed 15 billion. You see, this is an emergency. It's an emergency. It should not be left to the states, otherwise we are in for it. It should not be left to the states, otherwise we are in for it. The commitment of the states are not the same. We need the unity of command, and the commander-in-chief should ensure that all the states take directive from him, which it should not be left. If it's left to the states, it's not about a sharing formula. It's not about sharing formula. This is an emergency that must be contained. And please, I beg the PTF, they should not leave it. They should coordinate all the activities of this pandemic. If you leave it to the states, we are in trouble. Why would they then deploy people to Kano? Because they thought everybody's commitment is the same. It is not. We want to beg, I want to use the name of Nigerian Medical Association to plead with the president and the PTF that they should please not leave it to the states. We know the powers of the states. Some states don't even have a single epidemiologist.
Right. On a final note, while we're not sure what that decision will be, we'll definitely wait to find out. But what would you propose? From what you have seen, the indications, the data, what do you think this next phase should look like? Should there be an extension of this gradual easing, by the way, which was extended for another 2 weeks? Should we extend it further? Should we move into another phase where it will be further eased, or go back to a lockdown? Basically, what do you expect to happen?
Well, that is speculative. What's the evidence on ground? For the past 6 weeks, what have we done? What is it that we have done that is working? And what is not working? How can we do it better? For me to I can't speculate. I mean, if you say lockdown is good, but it has its own implications. There must be palliatives. Everybody should be given support. Nigerians will be given support. Is it possible? Is it doable? That's the questions that people will answer. It is true, it's very easy to say lockdown, but if you lock down, you must then follow with what is expected, and that is the palliatives. And Nigerians are crying all over the place that they are not getting the palliatives they say they are giving. And how long would they do that? The economy will ground to a halt. All we need to do is to reorganize, strategize, reevaluate, and see what works and what does not work. What is working, how do we do it better? What is not working, how would we do it what do we do to make it work? It's not just lockdown. The associated factors, the implications should be clearly defined. Left for me, lockdown, I mean, if we don't move, coronavirus does not move. But if you don't move and you have no food to eat, will you die of hunger? So we must balance our strategy. And that is the best way, in my opinion, to look at this thing. If you say people should stay in the house, many of the Nigerians go in the market in the morning and bring out and then sell their products and then bring in what they will eat in the night. It's a daily affair. So it is neither here or there. The economy is in tatters. The Nigerians are suffering, and I do not have the direct answer. But the truth is that we must balance our actions so that in the end, we do not leave ourselves worse than what we wanted to do. And that is my response.
All right, Professor Innocent Sujat, President of the NMA, thank you very much indeed for your time. And again, we wish you all the best.
Thank you very much. And this is my first official activity with channels. And I wish you the best. And we'll work together.
All right, thank you.
To our people. That
all right, then.
A mandate. Thank you very much.
Okay, well, back in a moment. Stay with us. Okay, well, we understand we're trying to get across to Dr. Okay, just until we're having back. Dr. Yahya Damo is the Chief Medical Director, FMC Kefi. Good morning, Doctor. Thank you for joining us today on the program. Well, I know, of course, you know, yes, indeed, some concerns raised. We've had several messages concerned people who have written into the station raising such concerns as to people who were infected, medical professionals, as a matter of fact. I know there was some reference to that in that report, but could you give us your own understanding of what the situation is?
Well, thank you very much for contacting us. The reality is that we do not have any of our personnel who are infected attending to patients. So, we had a doctor who contacted the virus from somewhere we do not really know and came into the hospital. And once we knew about what happened, we made sure he himself and all his contacts were quarantined. And when we now tested all the people who had contact with him, and 2 of his colleagues also happened to be positive along. And on noticing that, we said, well, this must be something that could go beyond what we really thought about at the beginning. So the first thing we did was to close down the Department of Obstetrics and Gynecology, pending when we know the total status of the place. And we make sure the whole department was decontaminated completely. And up till now, as I talk, it is yet to be open. We're only now, because after closing the place, we made sure every person who may have had one contact or the other with him was tested. And the results just reaching us have shown that practically, apart from those 3 doctors that have tested positive, no other person has been positive. So we are looking at the possibility of coming up with gradual commencement of services in the obstetrics and gynecology department.
I mean, because some of the messages we had was that the doctor was coughing, he interacted with nurses, other medical professionals, and then they saw him moving in those areas, and that was why they raised those concerns. Are you saying that that didn't happen?
Well, I'm not aware of that because there was no doctor who we knew was sick that was allowed to come to work. They have a basic instruction that anybody who feels ill should stay at home and give a call to his head of department. But a particular doctor came in, and once we noticed he was not feeling well, we isolated him. Unfortunately, after he had come in, he had contact with some of his colleagues at work, both nurses and doctors, and that really necessitated the immediate closure of the Department of Obstetrics and Gynecology.
You also said that you've talked to all of his contacts. Do these include nurses, patients, and some canteen workers that he may have interacted with? You also, of course, know that 2 weeks before he tested positive, he may have been, talking with people, contacting people, and he may be asymptomatic. So, do these contacts that you traced include patients that he may have interacted with in due time?
Oh, yes. We do have... Hello?
Go on, please.
Yes. In the hospital, we have a public health department, and we make sure every positive case we get in the hospital is tracked and traced to every contact, whether it's patient or staff. There was no exemption in this respect.
true that well, one of the things that's been written to us is that you refuse to close the hospital because of the revenue being generated. Is that correct?
Well, I'm sorry I have to laugh at this moment, but it's unfortunate. For anybody to make such an insinuation is unfortunate because, in fact, even in the accident and emergency, when we heard that somebody had had a contact, what we did was immediately shut down the accident and emergency for 3 to 4 days until we have decontaminated the place, just because a patient that was suspected passed through the place. Even as it is, we ensure that even in front of the emergency, we have a place we call an isolation unit where we keep, where we try to keep people segregate even with any slight complaint that suggests that before we allow into the emergency room. So we cannot, for any reason of economic benefit, keep the obstetrics and gynecology open just because we want to make money. I don't think that is true. It's far, far from the truth.
Doctor, could you give us some sort of timeline now, starting with telling us when was the department closed? Because he says, according to the records, that it shows that up till 22nd of May, patients were still being attended to.
Well, I don't know where the person has his own information from, but from what I can tell you, from the date I knew that this patient, this doctor was positive, we immediately closed down. In the first place, there is nothing that is written on anybody's face that says...
Dr. Adamu, when did you know and when was it closed?
I knew about it on, was it Monday or Tuesday?
What date was that?
It was on Monday, yes. I got to know about it on Monday last week. That's a week ago. And it was 2 weeks ago. And immediately I heard about it, I instructed that the place should be closed.
When you say Monday, do you mean Monday the 18th or Monday the 25th?
I know it was a Monday, I think last week or thereabout, or 2 weeks ago.
Okay. Because if it's Monday last week, that's the 25th of May.
2 weeks ago. 2 weeks ago. Because I know the last week Sunday, I visited the doctors in the isolation room. That's the doctors that were being treated.
Right. Okay, so that's the 25th. But then also making reference to some of the issues raised in that whistleblower's report. Now, the person said that the infection knowledge or the infection control knowledge, attitude, and practice is poor in the FMC. I'd like you to respond, especially what kind of training did you do? Because we know this is novel and a lot of people were not really prepared for this. So how were you prepared for this? How well is that infection knowledge imbibed?
I am really surprised at this allegation as well, because as early as March, as soon as the first case was identified, we set up our task force for the management of the coronavirus disease in the hospital. And even as I talk to you, we have been training every staff, and in fact, including non-clinical staff. As I talk to you, from the cleaners, security, and everybody across board is being trained. There is no single staff who works in this hospital, whether it's on our employment list or is one of the outsourced staff. We do not make any differentiation. As long as you have contact with patients, you are our staff. And nobody has been excluded in this training. So I don't know where this information is coming from, but if you come to FMC Kefi, you don't need to be told of the level of awareness for this disease in the hospital. Because right from the gate, you will notice that, yes, there is a high level of awareness for this disease in the hospital. You will not even be allowed in until your temperature is checked, unless you are in your face mask, and you have several points for hand washing, use of hand sanitizers, and all over. And we've told people the do's and don'ts at every stage in the hospital. So I do not know what some people stand to gain by carrying stories that do not have basis. That's what pains me.
Oh, well, it's good you cleared the air on that. But also, is that during the course of interaction and training, have you found maybe doctors and nurses that don't believe that COVID-19 exists? Because we've heard reports. And if that is the case, what are you doing?
Well, frankly, I cannot tell you I've heard of any doctor or staff who claim, who does not believe in the existence of the COVID-19 in this hospital. If there is, maybe it's a personal thing, and I'm not sure I'll be able to know that. But as far as I know officially, I do not know any staff who does not believe in this, because I remember at the outset of this disease, I personally moved around every department of this hospital, informing and educating people before the task force took off. And immediately the task force took off, I allowed them, their education committee, part of their job on every day. As far as I talk to you, if you have anybody around, come to the hospital, you'll meet them at the training center. We have at least 4 training venues within the hospital where trainings are going on concurrently with, for every level of staff.
You know, but Dr. Adamu, the report, the whistleblower had the basis, because you yourself did say, you confirmed that there was a case like that in the gynecology department, which he also said. You said when you knew about it, you went in and you shut the place down, which he also said existed. So that's a basis for him to have raised some of these things. And is there anything wrong in people raising issues? After all, it's going to protect everybody else at the end of the day.
Medical personnel or not, we are all citizens, and they interact. We cannot prevent their private interactions. We do not follow them home after they close. So we do not know where they go or where they don't go. And when he comes back to work, and he's not showing symptoms.
It's not just medical personnel. My apologies. It's not just medical personnel interacting. It's medical personnel who are demonstrating every symptom of COVID. They have every reason to be concerned if they see that.
Well, I am not aware there was any report like that from ONG that somebody who is symptomatic was attending to patients. Okay, I'm only told that one of the doctors was sick, and when they mentioned the symptoms.
Oh, yeah. Okay, because I was going to ask him. So, okay, go ahead and tell us on what basis was it closed then?
As soon as.
Go ahead, doctor, if you can hear us.
Quarantine, and then we closed the department because we now know that it's beyond one person.
It's beyond one person now?
Yes.
How many cases now at the moment?
3 now, his 2 friends.
Oh.
There are 3 doctors, and the 2 all got through him, and they are all in the isolation and in the treatment center.
Oh, okay.
One then wonders, you are very shocked at the fact that someone blew this whistle. Are you saying that there was no basis for the person to have blown the whistle?
Yes, because if he says we allow those who are sick to be attending to patients, it's a fallacy. Because we don't do that. It is against the policy, and we know it very well.
Right, so on a final note, so the department is closed. What is the plan to open it? What are the indicators you're looking at before you open this? And is there a possibility that it has gone beyond the department too?
No. As I talk to you, we have already tested all those who were working with him in the department, whether they are his friends or working directly with him or indirectly, and all results, apart from those 3, have turned out negative.
Yeah, but doctor, why did the hospital have to intervene to isolate him? Why didn't he isolate himself in the first place?
Well, he's a human being. I don't know how, we don't have power to control his life. He brought himself around, and immediately we noticed that he was sent out.
But was it right for him not to have done or isolated himself?
The instruction we gave from the first day was, if you feel ill, stay at home and call the head of your unit.
But you found out that he was ill and he was still treating patients.
No, I am not aware of that. If anybody knows that, let them come and let us know. I'm not aware. The truth is, he came into the hospital and we discovered that he was sick and he was sent out.
Yeah, but that's the same thing. You discovered he was ill and he was coming to work, exhibiting symptoms of COVID. No, why was he then allowed to be coming to work?
Excuse me, sir. I didn't say he was coming to work. I was told he was in the call room, staying with his colleagues. And I think those 2 were the ones that became positive, along with him.
Okay, I'm afraid we've exhausted the time, but there's still questions. If he was in the call room, he came to work. Okay, but doctor, we appreciate your talking to us this morning.
Who are we to stop him? He has the control of himself.
No, but if you allowed him into the premises...
The policy, what I want you to understand, it is not the policy of the hospital. The fact that he breached the hospital policy does not mean it's the hospital policy.
If he breached the hospital policy...
Understand the difference.
I'm afraid you lost me there. He breached the hospital policy.
By coming into the hospital, because we told him clearly, if you have anybody who feels ill, to stay home. So if it's a breach of the hospital policy.
So are there penalties for people who breach hospital policy, for professionals at that?
I didn't get that.
Are there measures? What's the consequence of breaching hospital policy by a professional?
The consequence will follow after he's been treated. Because right now, he is a patient. I cannot take any punishment against him now because all we were doing was to make sure we keep him away. He's right now in the treatment center in isolation. So we cannot, exact any consequence, the consequence of his action on him right now. Because even in law, if you are sick, you are treated until you are well.
All right, Dr. Yaya Adamu, Chief Medical Director of FMC Kefi. Thank you very much indeed for your time this morning.
You're most welcome.
Well, back in a moment, everybody. Stay with us again. Welcome back. Well, talking still on some COVID concerns, but the economic perspective of this. Paul Alaje joins us now. He's an economist. Good morning, Paul. Thank you for joining us today on the program. Well, a lot will be expected from the states now, as the Presidential Task Force on COVID-19 have indicated. But let's take it from this stimulus package. It's one thing to see and read of all of those policies and measures and funds that have been channeled. But from what you've seen, are they making an impact on the people?
I thank you so very much for having me, and good morning. The stimulus package government has provided total number of targeted persons that government have tried to reach out to is about approximately 3.5 million. Recall that there is another list of about 1.5 million. State government, cumulatively, we are charitable, we can also say another 1.5 million. Now, private sector, led by Mr. Aliko Dangote, is also targeting another 1.5 million people. When you put all of this together, we have 8 million people. The impact is this. National Bureau of Statistics says about 82.9 million Nigerians are poor. So out of 82.9 million Nigerians that lives less than $1.90 a day, all our energy to target the poor during this pandemic, it's only 8 million people. That is less than 10% of those that we want to reach. And that, I think, is the reason why it's a bit challenging to cater for the poor, let alone the middle class. We are just talking about people that live less than $2 a day. We have not started talking about people that live less than $5 a day, let alone $10 a day. And even if you don't want to pay attention to those that live prosperously, about $100 a day, we don't want to talk about them. But the conversation is around the impact on these people. So we have tried, government has tried at federal level, state level, and particularly private sector have tried in terms of contribution. But is this sufficient to provide for huge number of poor people we have in our country today? The answer is no. What impact again has it had on GDP, for instance? GDP has emaciated. Recall that 2016, Nigeria was in recession. We are struggling to come out of recession, and we have grown significantly to about 2.55% GDP growth rate. But Q1 report shows that it has significantly reduced from what it was, and chances are high that second quarter report, which of course is the quarter we have now, by the end of this month, and National Bureau of Statistics release what the quarter report is, that Nigeria may have negative report. IMF confirms it. Our Minister of Finance had confirmed it, and so many other authorities and institutions and reputable economic organizations have also confirmed this. Unemployment figures, the figures that we have is high enough at 23.1%. But when the new report comes out during the pandemic period or pandemic era, during the great lockdown, as IMF we call it, I can tell you we should not expect less than 40% of people that are unemployed. It can increase to 12.34%, and the numbers are just continue to go from bad to worse because of the pandemic. The impact on our currency It's what we all can feel. The impact on our foreign reserve, of course, we dovetail into our economy. Foreign reserve has emaciated below $40, and crude oil prices, which of course is the mainstay of the economy, has also gone beyond, crude oil below $40 billion US, in terms of foreign reserve, and crude oil price below $40 per barrel. Also note that because of our agreement with OPEC+1, we had also reduced our output from above 2.3 that government targeted in 2020, 1 million barrels per day. As if that were not enough, our price and output are both reduced significantly, leaving us with less revenue that we could use in the coming period for to finance government expenditure. And what is the biggest impact and the biggest blow on the entire economy is 2020 budget.
Just before you go to that point, is it then tenable to you? Because, if you haven't highlighted all of those 8 million people, less than 10% of the population, funds shrinking, is it then tenable to you when you hear people say, look, it's one thing to channel resources to the appropriate quarters if we can, it's another if we don't have the resources. So is it tenable to you when they say we don't have the resources?
It's very tenable. I don't think we have resources because I don't think we have resources. One, we are not prepared. Two, we're just coming out of recession. I don't think we have resources. I don't think Nigeria has even ever planned to take care of people directly. It never happened in Nigeria, at least in the recent history of the Fourth Republic. That government took responsibility, they want to take care, so there was no plan. Everything was fire brigade approach because the pandemic did not give authorities notice. It happened with the first index case in Lagos in late February, and a reputation and the first death recorded in Abuja. All hands, as at that time, were on desk, and government just wants to do everything possible. Unfortunately, we have been overwhelmed by the total number of people that are poor because the number is quite outrageous at over 80 million people. It is now that we appreciate it that the total number of people that are poor in Nigeria is approximately the entire population of the largest country in Central Africa, DRC Congo, and it's multiple. It's almost times 3 of the population of Ghana. So how do you take care of them? It's a big one. When you look at our resources at the time when resources was falling, global oil prices as nosedive. At the time, America sold its oil at negative price. Brent crude was going for less than $15 a barrel, and Nigeria had several vessels that no one was claiming. There was just no way government will finance this. When you look at taxation as an option, CIT, companies were shut down, companies were locked.
Just one moment. You've talked about the fact that we don't have sufficient resources, and some people might argue with that. Well, you are going to taxation, but that's another, one that government is perhaps beginning to try to explore. And talking about exploring, when you say we don't have resources, I think you may need to explain that, because with all the mineral deposits, all our potential in agriculture in Nigeria, is it that we don't have the resources, or we are not exploring or exploiting our resources?
The truth is that agriculture is a major window for people to get jobs, for companies and individuals to get revenue. But I can tell you, the revenue for government from agriculture is very, very low. First, the law today says that if you have an agri firm or a firm, you are not going to pay taxes. So how will government make revenue? There is no VAT on agriculture. How will government make revenue? But when you see the opportunity in agriculture, and I'm even afraid the rate at which we practice it, our star product in Nigeria today is rice. And one of the biggest challenge most milling firms have today is paddy rice, which is the input. Kebbi is doing excellently well. Jigawa, we're what is happening in Benue, and Kogi is also joining the league. But I can tell you there are more states, at least 15 states that have good land for rice farming, but state government are looking the other way, or maybe they don't even know how to go about it in some of the states, particularly 7 of them in the south and 3 more in the northern part of Nigeria. They are not focusing on it. But what is the big deal? We have more and more mills springing up in Nigeria. The current administration has increased, I beg your pardon, the production of rice by 1 million metric tons in the last 5 years. And the gap still remains 3 million metric tons. The gap is still huge. And so if you have a mill that is average industrial size of about 2 hours, 2 metric tons per hour, and you know what that means at the end of the day. Even if you have a very large one at about 5 metric tons, 60 metric tons, I beg your pardon, per day, or 100 metric tons per day, you still cannot fill the gap that we have in market. And that is why price of rice as of now is ranging between 22,000 naira per bag. I'm talking about 50 kg. To 32,000 naira per bag, and there are brands that are selling and people are still buying it. Why? Because of the gap. So if you say agriculture, how do we make money from agriculture? I've been asking people the kind of money you make from crude oil, and that was why it was neglected in the first instance. Because the model we run for agri is not sufficient. 40% of households in Benue is wasted. Another 30% from Benue is underpriced. Farmers only maximize 30%. And farmers don't pay personal income tax, they don't pay VAT, farmers don't pay company income tax. So where is the money going to come from government? Even if they are sold to government, that arrangement is not currently in the model. What I have expected is that state government will provide seedlings, rice seedlings for farmers, and buy output from them and sell to millers. So government can get back money and even get profits.
Let me just follow up on something you mentioned earlier, Paul. Pardon me. Let me follow up on something you mentioned. You know, when you say that the revenue from agri sector is low, there are people who are listening who are thinking about getting into that chain, and then when they hear you say the revenue there is low, they may be discouraged at this point in time. Was that what you intended? I mean, how can they maximize or leverage on that? Should they still go in, having heard you say the revenue is low?
No. The government should not be discouraged on investing in agriculture. That is where you have
not just government
of your population. If you are discouraged, in investing in agriculture, you are going to have serious crisis. So the right energy, the right way to go is to invest more in agriculture. But don't let your eyes be there in terms of revenue. Government constructs roads. Government is not expecting direct money to come from the road you have constructed. You know, people will use the road to facilitate trade, businessmen will be taxed and they will pay back. The same with agriculture. And in fact, most of the sector government will spend money on. But what I'm saying is that agriculture is not that chicken that lays the golden egg. That the government should invest in it, but you don't necessarily expect return on it. It's like sending your child to...
Mr. Laje, some might also argue with you on that. You referenced the First Republic the other time. It was agriculture that the entire nation depended on. For instance, I mean, you know about the groundnut pyramids in the north. You know about the southwest cocoa and, you know, all of those things. So... that was the mainstay. Agriculture was the mainstay of the nation at the time. Now you have also talked about the fact that many states are not even leveraging adequately on their resources. If they were to do that, wouldn't we have agriculture as a sustainable mainstay for Nigeria?
Yeah, we're going to have agriculture as a sustainable mainstay for Nigerian people. But in terms of government revenue, agriculture will not be the main thing government should focus on. And I don't want to be misquoted. I am saying that agriculture is good, but for government to generate more revenue, government should look the other way other than considering agriculture as a main source of revenue. Kebbi State is the largest producer of rice today. How much comes in revenue from farm, from rice from Kebbi, if government has not directly supported in terms of provision of the seedlings and so on and so forth. But if government have provided land, government have provided seedlings, then it is normal. It is right for government to expect revenue. But you see, in agriculture, social good is more of social good than economic good. Of course, it will be economic good. How do we provide jobs for our population? Is a stronger conversation compared to when you look at what is happening with crude oil. Yes, it was a mainstay for Nigerian economy, but those commodities were largely for export. Rice for today is not yet for export. If Nigeria wants to reconsider so many other output minerals that we have all around the country today. Then agriculture will make sense. And you know, agriculture is not just the only mainstay. We have mining that we are doing very little about. We have seen some Nigerians that are doing some things about mining, but I think the capacity is still below 30% in terms of what we can actually achieve. So agric is fine, but there are other sectors that are green that we need to consider so that we can boost revenue of government.
Right. Now, for some people, maybe golden egg will be food at least. So if agriculture might not give that revenue as much, at least it provides food. And you know, some people say once you take food out of the equation, then half of the problem is solved. But as we wind down, we've seen the figures from the NBS regarding, you know, poverty and inequality. Well, they're not using income this time around, they're using expenditure. It was basically saying that people that earn less than 137,000 naira per year are considered poor in that regard. And we've not even factored in what, you know, COVID has done, the amount of people that have been taken out of jobs. If we need to begin to at least cater for those people, what is the direction we should look into? You think agriculture might not work. So what would we do on a final note?
No, for these people, agriculture will work. So why I'm not against agriculture in any way. I'm in fact for agriculture. I'm just saying that investment not necessarily improve government revenue significantly when compared with other sectors such as mining and compared with crude oil. So agriculture is one of the things government should consider. It's very important. And also to see how to mitigate the effect and the impact on these people that are poor, I think government should start opening, should open more sectors starting from today. And I would say number one amongst them should be hospitality. We should consider education, because school teachers who teach in primary school and in private school, I beg your pardon, have been out of job for a while, and I don't think that those people are going to be paid, because the nature of private sector and a structural pattern in Nigeria today. Resumption of all contractors that are working for federal and state government should start happening, even if not now. They should all go back and start working. Now, NCDC guidelines should be respected. It should be followed to letter. 2 meters distance, washing of hands with soap and water, the use of face masks where it is required, and also provision of hand sanitizer. Aviation. So those are things that will facilitate trade. You see, it would be wrong for us to think that we can create an economy for poor people without having influence, without being influenced by those that are well-to-do, by businesses and organizations. I have not seen one country that have lifted people out of poverty by just trying to create an economy for poor people. It's either poor people provide service for those with effective demand, which you can call people that are prosperous, or people that are average, people that have decent income. So in this case, what are countries done? China is the first example that comes to mind. China understood it has a lot of people in poverty, but was able to lead approximately 200 million people in 2 decades. Which, of course, it tells us that what President Buhari says he wants to achieve in terms of lifting 100 million people out of poverty in 20 years, in 10 years, I beg your pardon, it's possible because a country has done it before. Now, these countries that have done it before have moved from primary to secondary. Before now, China was told lie that is told to Africa, and it was formerly told to Europeans that they are to feed the rest of the world. But China understood that the jobs, though they are on farms, but sustainable jobs are with the manufacturer, are with the processor, are with the millers. So what China did was to reposition as the production hub, production center of the world. And in 2009, China had the largest export of...
All right, then. We do thank you very much indeed for your time and perspective this morning. Mr. Paul Alaji is an economist. We will be back and then take a look at some materials, feedback from you, actually. So don't go away yet. Welcome back. Let's take a look at some messages. Martina says, can the NMA president tell Nigerian public what his agency will do to address the systemic corruption that goes on at the National Hospital Abuja with duplicated billing? Okay, well, Martina seems to know what this is about, because, I mean, we like to be aware of this as well.
Well, take a look at this next one. It's quite interesting. It's a question from Tokis Bola, I believe. It says, Is it not ironically disturbing that in spite of the interstate lockdown recommended by NGF, some governors continue to lead, according to him, he believes, by bad examples? How are the APC governors able to travel to Lagos for a political meeting and lock up the rest of us? Huh.
Oh, that happened?
Well, that's from Tokunbo Shinyabola. Question there.
Makwa, you got the next one?
Okay, I don't know if that's my cue now, but looking at this one from Tokunbo Shinyabola, he says, is it not ironically disturbing that in spite of the interstate lockdown recommended by NGF, some governors continue to lead by bad example? How are the APC governors able to travel to Lagos for a political meeting and lock up the rest of the country? What a shame.
Okay, that
we have to take it twice.
For emphasis.
For emphasis.
Well, there's Babajide as well.
Yes, Babajide Akinremi says, I'm afraid our whistleblowers' laws may not be protective enough. In a country where we have kings with absolute powers as leaders of public service, we need to do better. If we're serious about checking our leaders' mediocrity, corruption, and abuse of office, we must provide matching incentives and layers of protection to whistleblowers. And that's talking about the whistleblower of the Kefi story we took.
Yeah, I mean, that's a serious matter that should be looked into. So if the FMC procedures and regulations are there, they have to ensure people stick to it and not punish the people who are blowing whistle or such things. So there you go. That is the show today. We thank you all for watching. We'll see you tomorrow. I'm Chamberlain Uso.
I'm Kairi Okikedu.
I'm Ayo Makine. Have a wonderful day.